There are other situations, and those are the more common ones. The flagrant abuses of the system are quite rare, but they do happen, but they're rare. The more common controversy arises from situations in which there are judgment calls. Patients who have moderate degrees of disease, doctors who try different approaches. The patient doesn't feel better. The doctor tries something else. The patient still comes back to the hospital with symptoms. Sometimes it's hard to decide what to do. Sometimes it's a judgment call. Sometimes you do stress tests, you do measurements, you do echocardiograms. All the tests are not very conclusive. And so in these situations, it's hard to say that a procedure was inappropriate. It is important for us as physicians to, one, explain to the patients why we're doing what we're doing, why this is controversial, why this is difficult to decide, how we, the physician and the patient, will try to come to a decision together, because the patient's input is important. And that's number one. And number two, it's also important that we document in our records that we are trying to do different things. We have tried one approach, it didn't work. We have asked for this test, but it wasn't conclusive. We have shown that this can go one way or another. And because of all this controversy, it is one's expert opinion or one's judgment call that a procedure may be necessary or may be helpful.